Hello, and welcome to another episode of the Pelvic Perspective podcast. I am your host, Dr. Joanne Michelle Martin, and I am a pelvic floor physical therapist, sex counselor, and doula immersed in the world of pelvic, perinatal, and sexual health and wellness, and love to bring those facets together with a holistic perspective on care. So, what are we talking about today? Today, we're talking about menopause. We are talking about just a general introduction to menopause. Menopause is a big topic, and I, for one, cannot cover that in the span of this podcast episode. But what I want to do is to be able to jumpstart the conversation, jumpstart many conversations really, into how we can start addressing menopause, how we can start looking at menopause in different facets of our society, our communities, with the people that we work with, we serve, and so on and so forth. So, just kind of to start you off, by the time women get to menopause, they've amassed so much just life, right? Wisdom and their careers, and they're excelling and they're doing amazing. And then we have menopause, and menopause in itself is not a bad thing. There's perimenopause, which is the time frame leading up to menopause, and realistically, that can be several years prior to the actual onset of menopause. All menopause is when the menstrual cycle ceases for 12 months. So let's say you had a period, you've been having periods, and all of a sudden you miss 3 or 4, right? We're not in menopause. We might be starting to change, but we're not in menopause yet. Because if a period comes again after that 4th month, the clock restarts, right? And now we've got to do a new 12 months. So it's menopause is really, we have had 12 months of no periods. And I know some of you are over there going, I can't wait. Yay. Right. And then after that, we're in postmenopause. So menopause in of itself is just the day, the time frame that we get to that 12 month of no periods. And then we're in postmenopause. And that postmenopausal time is going to be critical. Once upon a time, lifespan and life expectancy weren't thought to be that long, or they weren't that long, rather. But now we've got women living well into their 80s, their 90s, and beyond. And the average age of menopause is around about 51. You have people going through it between like 46 and 52 ish, right? Just on average. They've still got the second half of their life left to live. So, how can we ensure that people are living their life well, right? We've got a whole bunch of people. There's so much research out there now. And, I was really intrigued by the fact that listening to someone at a recent conference who said 96% of women are unaware, like they have no information on menopause. 7% of physicians, so Mayo Clinic had done a study, and 7% of clinicians, of the physicians, said that they did not feel adequately prepared to address the symptoms of menopause. And this is huge, right? This is huge because then we also have to consider, well, what happens if menopause starts a little bit earlier, right? We've got about 10% of people who will experience menopause before the age of 45. And then we've got a smaller population, about 1%, who's going to experience menopause before the age of 40. That's called premature menopause. And that's actually really a clinical issue. So that's something to kind of think about. Now, let's kind of break this up. I don't want this to be sad times, right? Fun facts. Just learned this recently, that the ovaries age 5 times faster than any organ in the body. So your ovaries are literally deteriorating. Fun fact, who knew? But then it helps you to kind of put things in perspective, because now we're thinking about fertility. We've got a lot more women who are, you know, approaching that perimenopausal period. And realistically, what's happening is they've also done phenomenal in their career. They've been living life. And then they're like, you know what? Now I'm in a place where maybe I can start a family. But then we've got to deal with one of the things that is not as often talked about, the infertility aspect surrounding perimenopause and menopause, because we've got so many more women just having families a little bit later. I'm trying to find the research here for you. The global rate of infertility is increasing by about 15% because the average age of a first time pregnancy now is 30.9 years. And that information I got from Dr. Sasha Stankovic of the University of Cambridge, and she's doing some phenomenal research there. And so, again, when we think about the changes that are happening, we've got to take all these things into consideration. So, let's talk menopause. What are some of these symptoms? What are women dealing with? So, we've got the physical symptoms. Everybody can tell you, oh, menopause, hot flashes. Oh, menopause, night sweats. I wake up in a pool of sweat. What's happening? But there are a lot of other not as well known issues that can creep up physiologically. So let's talk about those. Pain. You hurt. It hurts. Everything hurts, right? So we may have pelvic pain. We may be dealing with pelvic pain because of the estrogen changes, because of just tissue changes, and that can be hugely problematic. Dyspareunia, which is a beautiful and fancy word for pain with sex, right? Who wants to hurt when they have sex, right? We touched on that in a previous episode, and we've got plenty more episodes to talk about this. But pain with sex and intercourse, genitourinary syndrome of menopause. So, nice fancy word, abbreviated as GSM, which is a condition, a syndrome, which is a collection of things that's happening in that postmenopausal period. So, we've got the pain, we've got the tissue changes, we've got the pain with sex, we've got vaginal atrophy. So, that vulva starts to change because the tissues are changing. The clitoris starts to kind of disappear. So we have a little bit of clitoral resorption. We may not have good mobility at the clitoral hood. And if you didn't know, as a female, that's really something that I encourage my clients, to check every now and again, right? Like, do we have good movement of those tissues? And dryness, vaginal dryness. So that could be one of the factors coinciding with that pain with intercourse. It's just we've got a lot of vaginal dryness. We're not as lubricated as we used to be, and therefore for sex is now irritating. They may also have bladder issues, incontinence. We might have just lack energy because of all of these changes going on in the body, right? So again, when we think about the physical changes, there's a lot going on. We also see that menopause is typically associated with increased cases of depression, lung cancer, bladder cancer, increased mortality, and there are reasons for that, and decreased cognitive function. So that brings me to my next point, quality of life. What is the financial toll of all these? You've got to go to all the doctors. You got to go to all the specialists. You got to go get all the tests. You got to go do this. You got to go do that. Well, there's a financial cost for that. There's also a psychological cost for that, in that that can bring about a lot of depression. That can bring about a lot of anxiety. That can bring about a lot of grief. That can bring about a lot of sadness because my body is changing. Who am I? Who is this person? So these are a lot of things, that concept of the loss of femininity and the loss of womanhood. And it's not to say that you are your ovaries, but again, when you have identified as a female, when you have, you have gone through your life, and your body's been amazing and it's been able to do all these things, and all of a sudden your body's like going out of whack essentially, and you're like, what is happening? That can be really, really huge, and can cause a lot of stress on any individual. There's also, again, early mortality as a warning sign associated with menopause. We also see that there are individuals, you kind of think of menopause as, okay, it's this thing that happens when I'm in my 50s, right? But like I mentioned earlier, you could be going through early menopause. What about those individuals who are dealing with surgical menopause? Maybe they had a gynecological cancer. Maybe they were dealing with endometriosis, adenomyosis, or fibroids and had surgical removal of their uterus and the ovaries. And more often than not, if the providers can, they will try to keep the ovaries there, but sometimes that may not be possible. And again, this is going to be patient specific and situation specific. So we also have to think about surgical menopause, which is the most common non obstetric surgery performed, hysterectomies, right? We're having tons of hysterectomies performed in our society. So that is also something that we need to consider when we're thinking about menopause. We also have to think about what does this look like for this individual? We talked about, touch a little bit on that mental health aspect, right? Depression and anger and frustration and anxiety. But let's talk about the woman who has worked really hard. She's been established in her career. She's doing phenomenal. And now she has got to adjust because of these physiological changes. She's got to adjust because she is dealing with these hot flashes and the sweats and the pain and the this and the that, right? That can take a toll on anyone. And when we think about work environments, our modern day work environments, our most work environments, set up in a way that they can give some leeway and allowances and provisions for women who are entering this period of their life, right? So, does your workplace allow for remote work or hybrid work or an adjustment of duties or some sort of flexibility? Does your workplace have a generous time off allowance? Does your workplace have benefits where it involves maybe mental health and or other provider care? Does your workplace have good employee retention? Right? And then we think about, everybody's like metrics, metrics, metrics. And everybody is like productivity, productivity, productivity. And we're looking at what that can essentially look like and how that can then impact someone who may be going through this time. So, are we considering, well, what is the actual performance of this person and what has that been historically outside of these new health concerns? Right? So, yes, they may be having this, but this has been a stellar employee. This has been someone who has been, a tried and true employee and beacon within the company, and they deserve this. Well, no, let's not give it to them because they're going through menopause. Let's give it to Joe, the guy, because he didn't deal with this, right? How many women then are being passed over career wise because there is not great workplace support? There is not good awareness when it comes to menopause and all of these things that are occurring. So, couple of things. I want you to comment on this podcast episode, share your thoughts on these issues, share your concerns, right? But also, if you are a woman and you're going through menopause, let's start considering a few things. Who is a part of your care team? Who's a part of your go-to team of providers, right? Of specialists? Do you have access to providers that are knowledgeable, that they understand what is happening? They understand this phase. They're not going to gaslight you and say, well, you're a woman. Well, thanks, buddy. I've been a woman the last 50 years of my life. Thank you for sharing that with me. Do you have providers in your area that are well versed in addressing these issues and can give good resources and tools to help navigate this? So, the bigger question also is going to be, how do we show up for menopause? How do we show up for menopause in a way that once we hit, we go through perimenopause, we hit menopause, or that postmenopausal period. How do we show up so that that menopause, once we hit that mark, everything after that is still quality, right? So here are a couple of things to think about. Maybe it might be time to know your baselines, right? If you don't know, if you haven't seen your primary care provider in several years, y'all know who I'm talking to because there's some of us out there that, for good reasons. Some of us may have had medical trauma, some of us may have been dealing with some things, but we really need to take the onus on ourselves and to really make sure that we're looking out for ourselves. Like self care advocacy is a form of self care, right? Making sure that you are well is a form of self care, right? And so finding providers who can do that for you, reaching out in your community to say, hey, who are the go to providers? Who should I go to? But really going to your providers and finding out what your baselines are. Get some hormonal testing done, sex hormones, thyroid hormones, what is your metabolic health? The second thing is that I would always recommend to my clients, because I am huge on the nutrition aspect, you are what you eat. And while I think supplements are helpful, you cannot out supplement a bad diet or bad nutrition. So we've got to make sure that we are eating well, because that's how we support the body. That's how we support the metabolism. That's how we support the energy levels and all the things. So making sure that we are eating well. Low inflammatory diets, according to the research, have been found to be really helpful during this phase of life. So that's a consideration. Gut health is health, right? We got to make sure that our gut is doing really, really well, because autoimmune issues are also one of the things that are prominent during this period. So, what else? Mental health. We talked about that, managing mental health. Who are the people that we can connect to in the area? Do you have access to good mental health therapists, apps, platforms, whatever have you, to help you navigate this time? Because here's the reality: the average person going through menopause, right? The average woman going through menopause may be a career person, they may be a wife, not necessarily. So, all of these things may or may not be going on, but at least some of these. They may be a wife or they may be partnered. They may be a parent. And guess what? I've got friends, I'm in perimenopause, and I've got friends like myself with toddlers, but we've also got friends with college graduates. We've also got friends who are grandparents. These are wild times, y'all, wild times. But it's interesting because we've got to be able to support people where they are. And so you may have, parents, you're navigating kids and relationship and career and all the things. And sometimes we just need a little bit of help, because then to add to that, when things are going on in your body, that's a lot for any one person to deal with. And so we may need a little bit of help. Exercise can be your best friend. Exercise has been shown to significantly impact body function, with regulating your hormones, increasing dopamine levels, which makes feel good, increasing endorphins, which help with pain, improving your sleep quality, improving your metabolism. You look good because muscle tones increase, that kind of thing. But it also helps with bone health, which is super important, because especially there's research that shows, and there was a systematic review that was conducted last year, concerning strength training during menopause, and it showed that it provided improvements not only in terms of muscular strength, and physical activity, but bone density, and there were positive metabolic and hormonal changes. Also, blood pressure was great, heart rate was great, and hot flashes were addressed because of strength training. So, one of my advices to every woman going through menopause is we need to get in the gym. We need to start strength training. It doesn't have to be every day, 2 days a week, right? Let's start lifting. Let's start lifting, if possible. And if you don't like lifting, then let's start off with something that you do like. Let's start off with some form of movement that you do like. I've never seen people dance that were unhappy. So go dance, get a hula hoop, go jump rope, go double dutch, do something. But let's start building some consistency with movement, because that can be really, really helpful. But again, when we think about all the things that are happening with menopause, how we show up is going to be important. So, again, your nutrition, managing your mental health, exercise, and just making sure that we are really taking the time to also advocate for ourselves as we are embarking on this period of life, right? It's new. It can be stressful, but you can do it. I promise you. So that's it for our episode. Please, please, please drop some comments, ask some questions for sure. Let's definitely stimulate this conversation and keep it going. So, bye for now. Again, my name is Dr. Joanne Michelle Martin, and this is the Pelvic Perspective Podcast. Here, y'all.